Guys, and welcome back to my channel. This week has been really stressful, but thank God here we are and here you are. So I hope you've had a nice day. Actually, this video I'm going to be telling you what UTI is. Actually, UTI is an acronym that stands for urinary tract infection. The women are usually faced with this more than the men, but the men also do have it. So I encourage that you watch it to the end so that you'll not be confused between the UTI and gonorrhea syphilis. So I just done this glass because I'm looking somehow plain without it, as you can see. Because I'm almost going back to school, so I need to look like this. Anyway, I've been playing on and on. So please do well to watch to the end. And this video is going to be broken into different parts because I can't say all at once in this video. So do well to subscribe so that you won't miss the other parts and any of my videos I'm going to be releasing. So do well to subscribe and like the video. I love you guys for that. Thank you. Now do well to endure my bad intro and then we'll go down to business. UTI, like I said in the introduction, is urinary tract infection. It's an infection that affects any part of the urinary system, whether the kidney, the ureter, the bladder, or the urethra. The ureter is the pipe that sends urine from the kidney down to the bladder, while the urethra is the pipe that sends urine from the bladder outwards. Now, this infection mostly affects the lower urinary system, which is the bladder and the urethra. Women are mostly experiencing urinary tract infection because of their anatomy, but men also do face urinary tract infection. But the lower urinary tract infection can be annoying and painful, but is better compared to any infection that must have degenerated to the upper part of your urinary system, which is the kidney and the ureter, because that one has great complications and consequences. On the screen there, you'll be seeing the picture of the male and the female anatomy of the urinary system. The bean-shaped organ there is the kidney, followed by the ureter, the tar with T-E-R. Then you have the balloon-shaped bladder, and then followed by the pipe there called the urethra, tra with T-H-R-A. That is the difference. You can pause and rewind for you to understand it better. The difference between the ureter and the urethra. Good. So doctors can usually treat this infection using antibacterial drugs and the rest, but you can also prevent yourself from getting UTI. I'm not going to say that in this video, I'm going to do it in the next video, but today we're going to be doing like how you can know you have urinary tract infections and the symptoms. What are you going to see or feel to know that you have UTI? So you'll feel a persistent urge to urinate. And then when you go to urinate, you feel a burning sensation when you are trying to pass your urine. Now, when you are overcome that burning sensation and you finally want to use, you just pass a little urine and you feel pressed, like really pressed, but you end up just passing a little bit with some stored inside. Now, that little bit that you passed out, you see it cloudy, like as if there's mucus in it. And then or you see it red, bright pink, or color, showing that there may be some blood stains in the urine. It can be strong smelling too, it can smell really bad. And then the women will have pelvic pain, usually in the center of their pelvic, around the pubic bone. Mostly this is some of the signs, but note, all these signs will not come at once. You won't experience the signs all at once. You may experience one of any of them. You may experience all of them at once. You may experience them stage by stage. So as far as you have any of them in you that is out of normal, then you know that there is something wrong. For the types of UTI, each type of UTI has its own specific signs and symptoms depending on where they are. If you have the urinary tract infection of the kidney, also known as acute polynephritis, some of the symptoms include back and side pain. Like during our classes, our school, I'm told that if you have kidney problem, if you are being touched around this side, I'll just adjust so that you can see this side, and the person feels pain and not a ticklish sensation, then you know that you actually have a problem with your kidney. Go see your doctor immediately. So that's your way, because you know the kidney is the most healing organ. at the back. In fact, if an operation is being done, it's not cut from the front, you get it from the back here, so it goes directly to your kidney. So you have back and side pain, and then you have high fever, shaking, chills, nausea and vomiting. Now if you have cystitis, that is inflammation of the bladder, you have pelvic pressure. Why? Because when you look back, the bladder is around this side, the pelvic region. This is where the bladder is. So when you have cystitis, you're going to have pelvic pressure. Yes, you're going to have painful lower abdominal discomfort. Yes, so here, this way too, is going to be painful around this side. That's why I say most of the women have pelvic pain. That's when your inflammation has reached the bladder. Now, you're also going to have painful and frequent urination, and then finally you're also going to be having blood in your urine. Then if you have urethritis, that is your urine or the infection is just at your urethra, down this side. Since your bladder is here, the urethra is the pipe that takes it outside. So you're going to having burning sensation during urination and discharge also. Remember what we said earlier, that most of this infection is in the lower part, which is the bladder and the urethra. The higher it goes, the more complicated it becomes and the more the consequences are. The better days of the urinary tract infection is when you still feel burning sensation when you're urinating, or have minor discharge, that smelling maybe, or you have frequent painful urination, abdominal pressure, pelvic pain. That's the better days. But when you have back pain, that leads to your acute polynephritis, that's really, really dangerous. So I advise that any slight change in your normalcy, do see your doctor, see your healthcare provider. You know, I'm going to tell you a secret. I've never had urinary tract infection. Like, I've never taken a drug for urinary tract infection. Whether pharmacological drugs or I go traditional, I've not taken none, because I don't joke with myself in that area. So in my next video, I'm going to tell you what I've done to help me keep myself up to this point without having to treat myself for any urinary tract infection. And then some things that you can do also to help yourself, and some other things about urinary tract infection. So please do well to subscribe to my channel, yes, so that you are going in confront a little bit, so that you are going to not miss my next video, which is really going to be very important. This is just like an introduction of the whole thing here. So please do well to subscribe and like this video, because anyway, I'll try for you people to do it. So thank you for watching this video, and I love you guys, and I love you guys. Please do well to share this video to all of your friends so that I can help them. Thank you.